You're watching Concussion Rehabilitation by Dr. Alyssa Gall on Resonance Wellness TV, part of our Whole Life Medicine Alleviate series. Keep in the loop about future webinars and events on whole-life-medicine.com.
Hello and welcome to Concussion Rehabilitation. My name is Dr. Alyssa Gall, and I will be your guide this evening about the exploration of concussions. And as usual, this presentation is given in the context of whole life medicine model, which is the model I use at Resonance Wellness when I'm evaluating your healthcare situation. So today we're going to discover that the root causes of a concussion may not be as obvious as we think they are, and that the overall health of a person definitely plays a role in how that concussion is healed, and that the ability to identify, respond to, and treat a concussion in a problem-specific program does require a degree of prompt action and a finesse that I think is highly unappreciated and often not pursued until a significant amount of damage is already done. So I have to say that in preparation for this lecture, as usual, I researched, and often, you know me, I just start at the library to see what's already been written for non-medical people. And I was shocked to find very few books on concussion at all, never mind helpful ones. So when I started to research in the journals, I definitely found more, and I found things that were clearly not being widely used clinically to help people with concussion. But overall, it brought home that misperceptions about concussion interfere incredibly with potential for more rapid treatment and recovery. And so we're going to talk about some of those things today. So we have to start with, what is a concussion? And I thought to myself, do I really need to cover what a concussion is? And then I really realized in my research, oh yes, I do. And it turns out that there's Canadian research that shows, like public opinion research that shows that Canadian parents, coaches, athletes, school staff, and health professionals, out of all of those people, 1 in 2 have little or no knowledge of concussion. 1 in 4 don't know how a concussion is treated. 15% can identify the best ways to treat concussion. 4 in 10 know how to find information about concussion and other resources. So this is quite sobering that there's really not a lot of knowledge out there about what concussion is and what to do when it's happening. So a concussion is a kind of quote unquote mild traumatic brain injury. Now, let me say that again. A concussion is a traumatic brain injury. So concussive signs mean that you've injured your brain. And mild is relative, but I don't think mild is a great way to describe a brain injury. Mild doesn't mean you should walk away thinking, oh, no worries, my brain injury is only mild. So concussions are referred to as mild traumatic brain injuries, or sometimes you'll see it abbreviated an MTBI, because they don't cause external visible damage. Instead, they're producing changes to the chemical composition of the brain that are literally interfering with brain functioning. And guess what? It is not always easy to tell that this is what you've done. And CT scans when there's a concussion and no other injury are normal. So in about 90% of cases, there will be no loss of consciousness. And the head doesn't even need to be hit to create a concussion. There's many other types of body injury that can transfer enough force to the head to create a traumatic brain injury. So I don't know if you remember this from a previous lecture, but I have previously shown you a picture of a fresh brain on a tray. It is basically the texture of Jell-O, and it floats in a sea of cerebrospinal fluid in an enclosed skull. It's wrapped up in a fibrous dura. Dura is basically like a membrane. It means mother. Dura mater is actually that fibrous covering, and it does protect it somewhat. It's like a bag where all the cerebrospinal fluid and the brain floats. But it's kind of like you've got your supercomputer in a case, you know, kind of like how well your phone is protected in its case. Haha. So I'm pretty sure most people whose phones went flying in a car accident would not be surprised if the phone had some trouble. But many people don't realize that your brain could have some pretty serious trouble from an equally phone-killing accident. And this is one of the problems in the perception of concussion. We can't see inside the skull very easily to see damage to brain tissue because, as I just said, imaging is not really going to show you concussion. It can show you a hematoma in the skull, like a bruise in the skull, or bleeding into the brain. It can show you a skull fracture, but it cannot qualify or quantify a brain injury. And I think that's the most important thing to remember. So it is true that for the most part, up to about 70% of people will recover in a couple of weeks. 10%, it will take longer than 2 weeks. And another 20% clearly have substantially more trouble recovering. So we're going to talk about all of those categories today. Now, I thought this is a great little slide that shows you that traumatic brain injury is a leading cause of disability globally. It turns out from this graph that Canadians and Americans are the most concussed people on the planet. And you will notice that this is not due entirely to bad driving, because you can see in the red, the Southeast Asian countries lead the way there. But there are probably about 210,000 concussions annually in Canada. Obviously, if you multiply, you'll get the American figure of about 2 million. And there are about 18,000 hospitalizations for traumatic brain injury each year. That is basically in Canada equaling about 575 people every day, or one person injured every 2.6 minutes with a head injury. So it is literally occurring at the rate of about 100 times that of a spinal cord injury, which most people are more frightened of. 1/3 of the individuals with a traumatic brain injury are women, and it's actually particularly common early in the reproductive years, like the 15 to 24, with intimate partner violence and accidents being the major causes. And women with traumatic brain injuries are more likely than men to experience mental health problems post-injury. They're also more likely, interestingly, to suffer with concussion from sport. There was one study I looked at that basically showed that female high school soccer players were twice as likely as their male counterparts to get a concussion. And this was coming from an analysis of data from more than 80,000 teenage players across Michigan. Some of it was that boys were more likely to be removed from play immediately after a suspected head injury than girls were, probably because a higher proportion of boys were injured by colliding with another player rather than with the ball or a post. But basically what they were saying in the study is that they were all finding the same things. Females are more predisposed to brain injury than males. And that's been researched also in female rugby players. So when injury due to stroke or other non-traumatic causes is included in this, it's about close to 4% of the population in Canada will live with a brain injury. That equates to over 1.5 million Canadians living with acquired brain injury. People living in more remote communities were significantly more likely to experience a concussion than those based in cities. The rural rates actually could be as high as 1,400 per 100,000 people, which is saying a lot because, of course, there's a lot less people up north. You can see that this graph in the green actually tops out here at 1,300. So that means that there's places in Canada where it's actually obviously higher, and it's up north where it's higher. Now, part of that can also be distance to care, for sure, but interesting statistics. And again, a lot of this can also be sports-related concussion. There are an astonishing number of people playing sport in Canada, especially some of the hard sports, like what I mean by hard surface sports, like hockey. We just got a ton of kids in hockey, and they're really prone. Some of them are really prone. So we're going to talk about this more. I wanted to do some kind of interesting historical detail here. and talk about concussions in history, because I thought it was kind of interesting. And so there's a number of historic examples of concussion or suspected concussion that are quite notable. And one of the most famous, and one I certainly learned about in my undergrad work in neuroscience, was a man named Phineas Gage, who's pictured here to the left. Now, Phineas was a railway construction foreman. He was packing a hole with explosives using a tamping rod when the powder sparked, driving the rod from under his cheekbone through the top of his skull. And this is a picture of his skull showing the damage on the top. You'll also notice that the bones on the back of the eye orbit are gone. You can't see so well here, but there's 2 collapse fractures in his cheekbones. And there's like kind of exaggerated little holes in the front of his face there. And it basically came up under his cheekbone and up through the top of his skull. So amazingly, he lived. So this picture of him on the left is actually post-accident, post-healing from the accident. However, his is the first documented case of somebody surviving a traumatic head injury of this nature, and the documentation of how that injury affected his personality and his behavior. So the tamping rod, which was 3.5 feet long, landed 80 feet away after passing through his skull. And the doctor cleaning the wound noted that about a half a teacup of brains had fallen out from his frontal lobe. So his wounds healed, but his personality completely changed. And he went from one of the most capable and efficient foremen in his company to an angry, impatient, swearing man, basically. He lived another 12 years, wandering from Vermont all the way to Chile and over to the West Coast, where he died of a massive seizure in California. So that's just one well-documented example of changes in people after head trauma. Now, on the upper right here is Howard Hughes, and Howard Hughes is a well-known millionaire, and he was considered to be a pioneer in aviation. He was also a very reckless test pilot, and he got in so many accidents and plane crashes that on really the final crash, he became a recluse, likely because he was brain injured. He was known for hiding in the dark due to light sensitivity. He used a lot of pain medication to live. He was known for writing repetitive notes to his employees on legal pads, like literally the same sentence over and over. And he died at about 70. But at that time, he was literally, there was like 93 pounds left on his 6'4" frame. The next down on this picture is Mary Lincoln. She was the wife of Abraham Lincoln. She was injured in a carriage accident when the driver's seat fell off of the front of the carriage, startling the horses to bolt. So she actually leapt out of the carriage and went from a wife who was handling all of Lincoln's home affairs and children and helping him with his career, to chronic migraines, delusions and hallucinations, photophobia, so light phobia, just like Howard Hughes, and hoarding behavior. And in fact, she became kind of the butt of a lot of jokes because she was so not right that people didn't realize, like most people didn't realize she'd had such a bad concussion, but she basically hoarded until the end of her life. It was a really sad story because from all stories, she was a very, very put together person before this accident. Now, bottom right, of course, you'll recognize Elvis. And Elvis had a very long history of head trauma. He'd been physically assaulted multiple times. He often had to travel with a police escort. One man actually hit him in the back of the head when he was attracting too many fans into the gas station that they stopped at for gas. So the boss of that gas station actually was trying to throw out like Elvis and the people who were getting gas out because it was, I guess, people just rushed it. And this guy who was an employee actually hit him with a 2x4, something on the back of the head. And that wasn't the only time. There was at least one other documented incident where somebody slugged him in the face because his wife carried Elvis's picture in her wallet, but not his. And after this hit, he basically was observed to stagger onto the stage to perform. He also had a habit of doing his own fight scenes, and he had multiple head contusions as a result. And last but not least, he tripped over a TV cord in the dark and fell onto the edge of the bathtub. And this was an injury that stopped filming of whatever film he was working on for about 2 weeks. And by the end of that, he had a huge personality changes, according to people around him. He became obsessed with police badges. He was always wearing dark sunglasses, and he totally lost interest in his previous hobbies. He had been for his whole life collecting horses, and he just basically dropped all of it. So huge changes in his personality. And of course, everybody knows he died very early at 42. And last but not least, it has been proposed that Henry IV sent into wife killing, massive obesity, and lavish spending, which bankrupted the crown, was likely due to a really severe jousting accident. His first had occurred in his 30s when he forgot to put his visor down, and the lance literally drove into his helmet. The second was when he fell off his horse in full armor, and it resulted in a 2-hour period of unconsciousness, after which he was literally reported to never be the same. He was known when he first became king as Merry King Hal, but within 5 months of this second accident, he started killing wives on unfounded suspicions. So really interesting cases from history that likely had concussion was having a huge impact. You know, even if it wasn't really clear. Obviously with Phineas Gage, the hole in the skull was apparent, but with most people, it isn't that apparent. And this is the unfortunate part. So when a person has an obvious head injury, they really should immediately be evaluated for concussion. A lot of people with concussion, kids, spouses, will insist that they are fine. Do not believe them. Really, I think it's important to have people evaluated. My husband went up for a header in soccer years ago, and when they took him off the field and asked him who his teammate was, he basically just said, or I think they asked him also what his name was, and he just basically said he was a soccer player. He didn't know his own name. Obviously, they drove him to the clinic. So there's a couple of ways to identify if there's significant signs of concussion. You can actually use a questionnaire. So if you have kids in sports, or you do sports yourself, and or you have a coach or something, it would be a great idea to download this. It's called the SCAT-5, SCAT-5. It's the Sport Concussion Assessment Tool, 5th edition. And basically, it's a way of walking a person through a set of skill questions and activities that help to determine how likely that person has had a concussion and needs a further exam. You can also use something called the King-Debbic test. And that test is based on the measurement of the speed of rapid number naming. So the test involves kind of reading aloud a series of single-digit numbers from left to right on a test card. And there's standardized instructions, and the test really takes 2 minutes to administer. It's often a test that's used pre and post high-impact sport activities like boxing, so that you can compare the speed of the task. And so the evaluation is based on the ability of the eyes to track properly, which is actually a sensitive method to detect impairment from concussion. And actually, there's a kind of therapy that utilizes that we're going to talk about later, that you should know about. So you should also at least notify your medical provider immediately, even if the person getting concussion is not transported to the ER, to have an evaluation done. And you should monitor symptoms for 24 to 48 hours after for headaches that get worse, drowsiness or unresponsiveness, an inability to recognize a known person, repeated vomiting, maybe not initial vomiting. It's not unusual for people upon first head whack to vomit once, but where you get repetitive vomiting, confused or uncharacteristic behavior, seizures, obviously, weaknesses, and unsteady gait or slurred speech. Now, these things will usually be quite obvious to you, but again, one of the mistakes that we make is that we don't always catch things quickly enough. So when to call 911 is also important. So these are the parameters for calling 911. So if the person loses consciousness for more than 2 minutes, immediate headaches that increase in intensity, like I said, repetitive vomiting, an open wound, especially an open wound where you can see bone on the scalp. If it's a scalp injury, that is very common. The scalp is quite thin. And head wounds bleed profusely. So there usually be a lot of blood with that. And also focal neurological deficits. So again, paralysis, if they can't move, loss of speech, slurring, and any kind of fluid discharge from the ears or the nose. You can whack the head hard enough that cerebral spinal fluid will leak. And so you'll see a yellowish clear fluid coming from the ears or the nose if there's a fracture that will allow cerebral spinal fluid out. So if you see that, if the nose starts dripping immediately after head injury, this is an ER situation. Now, like I said, imaging doesn't always tell you everything that you might want to know about a concussion. So imaging is warranted if there's any of the signs that are leading to contacting emergency services, because chances are good there's either a fracture or potential cerebral spinal fluid leak or a more marked bleeding. And CT scanning is the imaging of choice to detect bleeding. That would be the most likely one that somebody would get upon entry to the ER. MRIs are not normally indicated in acute settings like that. But again, a concussion can be entirely invisible on imaging. So if you have symptoms, don't let anyone tell you you're fine. There really is no single test that confirms or denies concussion in the imaging department. There are no good blood tests to predict concussion thus far. There have been a few markers that have been researched in the last decade, but their results are not reliable. And so you really want to go based on symptomatology. And if you feel like there's something wrong, there probably is. Now, after discharge from the ER, ideally what would happen is people would be referred to concussion specialists if they have a concussion. In Calgary, there are concussion specialists at WinSport, at U of C Sports Clinic. There's likely a number of other clinics that can handle that evaluation. You're really looking for a licensed healthcare professional with training and experience in concussion management who really sees a sufficiently high volume of cases to evaluate it. And that person should really be taking a very good history, should do a good exam, like a physical exam, should do an evaluation of the symptoms and a charting of the symptoms, and should do some neurocognitive testing to see if there's any impairments. The whole point of doing this is to make sure that you have trackable symptom evaluations because, again, unfortunately, there are no great treatments for acute concussion that are recognized by most of medicine. And we're going to talk about some of those issues today. But getting a good evaluation gives you a record of what actually happened and what was observed so that you can compare and contrast over time. So one of the things that people don't understand is that traumatic brain injury is a process. It's not just the original event. So the initial injury is really only the beginning. A brain contusion is a cell death that's accompanied by hemorrhage or bleeding. So this can actually occur at a site quite distant from the impact site. So the brain is injured because you are literally whacking it sometimes on the inside of the skull, which is a hard bone. Then there also are the effects of intracranial pressure. So the brain swells with edema. So excess blood can accumulate, cerebral spinal fluid can accumulate due to the blockage of outflow. If something gets swollen, it doesn't let fluids pass. And this actually creates an increase in intracranial pressure because bone does not move. So there's only one normal hole in the skull, and that's where the spinal cord emerges from the brainstem. And if there's enough pressure from poor circulation, the brainstem can actually herniate down through the foramen magnum or the hole that's there. And the pressure on the brainstem where the breathing reflexes are can put you into respiratory arrest. So you can see here on this first picture to the left where the little arrows are, that's actually showing a CT scan where you're seeing blood accumulating. You can also see that the brain's being pushed away from the midline because it should normally be symmetrical. It's being pushed over to the left-hand side of the picture. And the midline markers are basically being pushed. So that tells you there's a lot of pressure from underneath the skull on that side. Now, the the second picture is showing that hole in the bottom, and you can just see there's some pressure there from the cerebellum, which is the rear bottom part of the brain. And that is actually herniating a little bit through the foramen magnum there, and it's pressing on the spinal cord. And unfortunately, right in those zones is right where all the respiratory reflexes are. So all of the vital reflexes, heartbeat, breathing rate, like some of the just the most basic things that make you alive, are located in that segment of the upper spinal cord, lower brain. Now, on the right-hand side, what you're seeing there are epidural and subdural hematomas. So an epidural hematoma, subdural hematomas, they're basically just referring to two sides of the dura. So outside of the brain, there are protective coverings, like we said, and that's where the main vessels are, and they can rip and leak blood inside and outside these layers. So in about half of TBIs, the axons themselves actually stretch and shear. So the white matter of the brain, so that's the main central part, like the stuff that's all in the middle, those are all axons. So the cells, the actual cell bodies of neurons, are the outer layer of the brain. So where you see in this middle section here, where there's that line, that squiggly line that's following the outline of the brain. So that's showing you the cell bodies of neurons. And then basically each of those cell bodies has this big, long axonal process that is forming the material of the white matter, or that whole big central section there. So when you whip your brain around, you're actually stretching that wiring. And the axons, like I said, will actually stretch and break. And this is a major cause actually of unconsciousness when these neurons are shear broken. And then you can get strokes because blood is leaking into the tissue and not returning through the appropriate channels. Now, obviously on the right-hand side here, you're seeing some really major head trauma. But even on live tissue, you'd be amazed at how bruised it looks. So experimentally, they mostly do this with mouse brains, and I was going to include a picture of that, but I think I didn't get one at the end. And so you're literally creating this bruised place in this enclosed space, and so it can be very serious as a risks is that it's happening in an enclosed space, and it's like normal inflammatory processes trapped. So historically, people have been told to rest until symptoms of concussion abate. And in part, the rationale for this is to allow for as much energy as possible to be devoted to healing. And rest is effective to mitigate further injury within the brain for about 3 days to a week. But active rehab is really necessary for people that don't respond to rest within 2 weeks. That's going to be about 10 to 20% of people. And those after about 45 days, which is going to be about 2.5% of people. So cognitive rest also speeds up recovery. And what I mean by cognitive rest is not just bodily rest, like laying down, like we're seeing here, but actually resting the thinking processes. And this is reinforced by a study that was designed to determine whether screen time in the first 48 hours after concussion had an effect on the duration of concussive symptoms. And so they compared one group that was permitted screens and one that had a very low use of screens. And the screen time permitted group reported a median screen time of about 630 minutes. So that was the average during the intervention period, compared with about 130 minutes in the screen time abstinent group. The screen time permitted group had a significantly longer recovery time of approximately 8 days, compared with 3.5 days in the low amount group. So again, if you have a kid with a concussion, there should be no screens, period. That will delay the recuperation, because you're asking the supercomputer in your head to heal and process millions of bits of data coming at it from a screen and auditory stimulation. Extremely important not to do that. Long term, of course, when people are laid up with rest, it creates other problems. Many people start to get quite depressed because they have all these concussion symptoms and literally no way of having social communication, because sometimes social communication in a long-term head injury is just overwhelming. So what are we going to do about this? This is Concussion First Aid. So what we want to do is to help decrease inflammation and improve cell energy and signaling and prevent neuron death. And so I'm listed here a set of interventions that are basically an adaptation of a book from the Amen Brain Clinics that's produced by a naturopath named Dr. Chapik. And so I've put here the type of nutrient that you want to use and also doses that you're wanting to use. So this is literally what you should be putting in as soon as possible. In the first 24 hours is actually as quickly as you can get it. If you can get it in the first 2 or 3, it'd be awesome. So why is this important? Well, it literally can make this huge change in how significant a concussion is. So as an example, on the top of the list here is NAC. That's the same N-acetylcysteine that we use for other things. In one trial of 81 military personnel, they were treated with either NAC or a placebo and evaluated within 20 hours of an artillery blast injury that resulted in a TBI with the symptoms of headache, confusion, memory loss, and insomnia. 86% of those who got the NAC experienced a complete resolution of symptoms, while only 42% of the placebo group had resolution by the end of 1 week. That's how significant these things can be to immediate recovery. Curcumin, which is the second on the list, is that extract from turmeric. So turmeric powder by itself is usually not strong enough. You're going to want to actually get the extract from turmeric, which is curcumin. That helps to decrease inflammation and swelling, not just everywhere in the body, but also in the brain. And in one study, it actually reduced interleukin-1, which is a major inflammatory signaling molecule, and it decreased the expression of aquaporin-4. That's a water channel that, if it's activated, increases edema. So in essence, you're decreasing the likelihood that the brain's going to swell like that. MCT powder is given, so that's medium chain triglyceride powder. That is basically a kind of fatty acid oil. And it's given because these particular compounds spur the production of ketone bodies, and that's a direct fuel for brain tissue, which your brain really needs as much fuel as possible in the beginning during healing. You can also use Bcaa powder, that's branched chain amino acid powder. That is basically all the amino acids that you would be using to make neurotransmitters, because again, your brain is just going to be so active during this. Vitamin C is used here as an antioxidant, and there's good data for that. Same with vitamin D. It actually helps decrease secondary injury from the calcium dysregulation that otherwise leads to cell death in brain injury. You can also consider using topical glutathione. There were some really interesting studies that showed that if you intentionally induce brain trauma in mice and then topically put glutathione onto their skulls, it really decreased the amount of brain injury. And you can get topical glutathione. I actually have put up this protocol and the products that I would use up on the FullScript account. So if you don't have a FullScript account with us, just let me know, because in case something happens, it's really good to see what is it you're actually looking for here and how many capsules of everything do you need. Now, red infrared LED therapy is something else to consider. The lights are a little bit on the spendy side if they're good quality, but you can use them, especially if you are involved in a lot of sport. And using that immediately greatly reduces long-term problems from a TBI. And diet-wise, what you're going to do is you're going to aim for low-carb, essential fatty acid rich like fish and flax, and you're going to avoid sugar and caffeine. All of those things will actually also help you to your recuperation. Now, post-concussion for a week, basically you're going to do some of those same things, and then you're going to transition a little bit more into doing things that are just basically increasing the building blocks of neural membranes and gentle anti-inflammatories. Omega-3s actually normalize growth factor for neurons, and they're usually deficient in the average diet, so that's why we're putting them in here. You also might want to consider progesterone therapy. There is great data for using progesterone with TBI. So if you happen to be, a female who has used progesterone cream for menstrual issues, it is actually one of the most extensively researched supports. In most studies, they use it by injection, but you can easily use the transdermal cream. It has a huge impact on holding hormone steady because, as you can well imagine, your stress gland kind of takes a bit of a hit with all the things that it has to do. It's also controlling inflammation. So if you have a good source of progesterone, you will basically support all those glandular functions. And like I said, really great data for that. So as you're coming to the end of week one of a concussion, you can really reattempt exercise if you're an athlete. But if you feel any concussion symptoms, you should stop, rest, and try again. Exercise is one of the only things that really increases the neurotropic growth factors called BDNF. That increases the sprouting of new neurons and increases the connections between existing neurons, and it protects your brain. So you do want to exercise to tolerance when you can, but if you're not in an athletic situation, don't exercise too soon, maybe about 4 to 5 weeks from the head injury. And then again, stop short of creating symptoms. Even if there's more energy to exercise, you cannot push through a brain injury. You really can't push through any injury, but especially a brain injury. HGH, or human growth hormone, also goes up with exercise, especially with interval training. So that's where you go as hard as you can go. Like you warm up 90 seconds, burst for 30 seconds, and then moderate for 90 seconds. And then you do that in bursting. That actually will help a lot with healing once you can tolerate something like that. Lack of exercises in the big scale just decreases healing, but you also don't have to do this every day of the week. Like 2 times a week is sufficient to exercise for recuperation. And again, just be careful of it. This is not the time to weekend warrior. It'll help to a degree, and then it will just make things feel worse. Now, I'm sorry, this is not the clearest picture for you, but I thought this would drive home some of the issues that we're faced with in concussion. So these pictures show the damage that's a result of a single injury. And so these pictures are showing active zones of inflammation created just by normal processes. And so this particular damage, like I said, was a single injury. And initially, all that inflammation is natural, and it's a good thing. And a little bit of inflammation can help protect brain tissues. But a lot of the time, if you're in a concussion situation, you're literally getting a kind of reparative cell called microglia that are wandering kind of amoebic-like glial cells. Glia are the supporting cells around the neurons, and they kind of swarm to fix damage to those brain tissues. And this is great to a point. So if the inflammation can be soothed, and then the brain tissue and the neurons can all be spared. And so if you, this is one of the cases where they were mentioning glutathione applied directly to the skull, and you can get topical glutathione, which I've put on the full script prescription. And if you administer it 30 minutes after the injury, it literally saved 67% of the cell tissue. And even when it was applied 3 hours later, it prevented 50% of brain tissue from dying. So if you are, again, a sporty person, or your child is, topical glutathione in that sports bag would be brilliant, just brilliant. And these are the things that I've been discovering as I've been researching how to acutely handle concussions. Now, again, I don't want to totally scare you, but there have been a lot of concussion discussions in sport. You may have already seen that more recently there was a movie called Concussion. It was based on a book about Bennett Amalu, I think his name is. And he was a Nigerian neuropathologist that was working on Mike Webster from the Pittsburgh Steelers. He was working on his brain. And he was the first person that realized that maybe repeated blows to the head were causing chronic traumatic encephalopathy. That basically means disintegration of the brain tissue with chronic hits. And in fact, research on 202 former NFL players found evidence of brain disease in nearly all of them, from athletes, actually not just in the NFL, but college and even high school. So the reports of this don't confirm that the condition is common in all football players. It's reflecting high occurrence in samples at a Boston brain bank that studies chronic traumatic encephalopathy, but many donors or their families actually contributed their brains because of the players' repeated concussions and also the troubling symptoms that they had before their death. So here in this picture, you're seeing sections from a normal brain on the top and from the brain of former University of Texas football player Greg Plotz on the bottom, who was in stage 4 of chronic traumatic encephalopathy. So obviously, this is confirming what many people actually feared in life, that there's evidence of this, and often in it pretty much in all the samples that they got from athletes in the NFL. There's another movie that's called The Lookout. It was produced in 2007, and I just came across this in one of the books that I was reading about concussion in the last month. And what was really interesting about it is that it was noted that the way that the main character represents concussion really struck home with a lot of people who've had the experience. And so if somebody close to you has had a concussive injury or suffering with it, it sounds like it would be a good movie to watch and just kind of get a sense of what they're actually experiencing, worst case scenario. Now, the original state of a brain can have an impact. Are you already inflamed? Are you on drugs or alcohol? Are you already on a poor diet? Are you genetically susceptible? And then you combine that with the various different kinds of tissues that can actually be affected by a concussion. And here we're talking about end organs. So that means you can have an impact on organs far away from the head, because obviously the brain is the coordinator neurologically and hormonally of many things in your body. At the base of the brain hangs your pituitary gland. It sits in its own little kind of skull indent. And in some concussions, you can whip the pituitary literally right out of the base of the skull. And that is the master hormonal coordinator. So you can just imagine what happens if you kind of just beat on it a little bit. It's not uncommon to see people who have thyroid dysfunctions or weight problems occur after a concussion. And it's believed that this is probably part of how this starts. And it's not easy to fix. There also can be peripheral nerve problems, so down through the neck and into the arms. There can be spinal cord problems like we showed with herniation down through that foramen magnum, and brainstem issues where you get all of those very basic life processes. The cerebellum can also be banged around. That is a place that coordinates movement. So you can damage the cerebellum and then have difficulty walking, basically. Then the thalamus and the basal ganglia, those are really a little bit more towards the center of the brain, but that's your emotional processing center. So sometimes people will present with signs of not being able to emotionally regulate very well. And last but not least, the cortex, that's really considered to be the place where you're doing a lot more executive functions, like higher brain functions. And it's the most surface part of the brain. It's a part that's most likely to whack the inside of the skull. So you can see that you're not going to have one effective management strategy for every single concussed patient. It would assume that all of those concussions are alike, but they are not. They're highly individualized injuries. And this is why you really want to have somebody evaluate what symptoms your concussed person has. Now, when it turns into something that's chronic concussion, like I've written up here, evaluate the hormones. Like I was saying, it can have a big impact, the damage to the pituitary. You also can add something called CDP. This is CDP-choline is a compound that actually improves damaged neural membranes. And in particular, it helps with memory and alertness in concussion. And I've listed a couple of other things here that are neuroprotective and decrease damage and improve symptomatology, especially in a longer term concussion. So this is less about the acute injury, and it's more about giving the brain cells enough support to continue to recuperate after the inflammatory processes are gone. And the symptoms, of course, long-term really vary. You know, people could be having headaches, chronic neck pain, concentration problems, sleep disturbances, emotional regulation problems, slow reaction times, memory problems, overload to the senses, like we were talking about with the historical cases, sensitivity to light, sensitivity to sound, dizziness, vertigo, blurred vision. There's a number of different things that can happen, and there are mechanisms for all of those things. Now, there's a couple things that I would consider doing if people are concussed. I can't tell you how useful neural therapy is with respect to pain and muscle spasm and improving circulation throughout the skull. And it is a therapy that involves needles. But this therapy drastically improves the circulatory problems that are caused by the response of the autonomic nervous system to the injury. I have treated injuries from an hour old to more than 55 years old, the injury, not the person. And this therapy continues to be very useful in breaking therapy plateaus and dealing with pain. Obviously, you can have direct pains on the head, the headaches that are part of the concussion. And basically what neural therapy is doing is reestablishing more normal flow. And that actually can decongest and move lymph out and decrease impediments to flow. I've actually used this, this is not a concussion example, but I've used it where it was visibly obvious that where somebody was having drainage issues. I had one patient with a tumor in the abdomen where we did neural therapy just on the places where lymph drainage is autonomically regulated right over the groin. And she literally dropped, what did she say, overnight about, it was like 10 kilo or 5 kilos of fluid. So that would have been over 10 pounds, 12 pounds of fluid out of her legs, which were absolutely literally full of fluid overnight from just opening it up like that. So you can imagine when you have brain swelling and headaches as a consequence, this is really useful. I also use this treatment in migraine for those of you who maybe have seen this. Next thing is taking a look at brain therapies. So I do the listening program in my practice. This is something that we use for learning disabilities and autism. That's what we used it for originally. Nowadays, though, it's been clear that improving the processing in the brain can be a key thing to helping people recover from chronic concussion, because in essence, your brain is attempting to find some way of bypassing traumatized areas. And this is a way of actually using a kind of music therapy to re-regulate how the brain is accessing information. Extremely useful in sensory overload where people can't stand auditory input or visual input. The other thing that I've listed here is something I don't do personally. It's a qualitative EEG, Loretta neurofeedback. So this is probably one of the better like biofeedback therapies that has good evidence to improve symptoms from concussion in the same areas. So in sensory integration and in brain processing. And it really just depends on the person, you know, what sort of thing people respond best to. But if you're struggling cognitively, these are two things to consider. Now, persistent post-concussion symptoms, a lot of it is often the neck. And there's lots of consensus statements in the literature that just identify neck injury is a really important potential concurrent diagnosis in patients with a mild traumatic brain injury. I think there was one study that I looked at where researchers at the Department of Neurosurgery at the Medical College in Wisconsin examined how often people reported neck pain in mild traumatic brain injury or concussion patients. And they were asked at 3 days, then at 8 days, then at 15 days, and then at 45 days post-injury how their neck pain was. And at 3 days, about 68% reported neck pain. At 8 days, 50%. At 15, 49%. And at 45, 41%. So you can see it didn't drop off super quickly. And a lot of people reported that it was the worst symptom. At least 18% of people thought that the neck pain was actually the worst symptom of their concussion. So you really do want to identify cervical injuries. Now, my best friend is a chiropractor, and I just checked in with her about like what's the best strategy for manipulation after concussion. And she's done a lot of further training in concussion and more subtle brain injury. And she said you really shouldn't be adjusting until people can kind of walk straight, and that you should be doing other kinds of therapies first. So your chiropractor may or may not be familiar with this, but she said you can stimulate the brain first with hot and with cold in the limbs. She said there's a lot of different techniques they can actually use to just calm things down that are pretty simple. And then you only adjust if you can handle the adjustment. She said there's techniques called tonal integrative correction technique. She said NUCA is a good choice under these conditions if you have a NUCA practitioner. There's another technique called torque release. They're all really gentle introductory techniques. And she said you just can't do typical adjustment until the light and the sound can be handled. So I think that's pretty good advice. And certainly I've seen people who have gotten adjusted too quickly after a concussion. They just can't handle it. Now, there are normal balance really needs input from the vestibular system. So that's the inner ear. You also need input from the visual system and the feedback that's proprioceptive. So you need to be able to tell where your body is, and that's coming from your muscle and your joints and your skin. So if balance and vision impairments are really playing a role for you in a concussion, there are a couple of different therapies that are available in Calgary. And on the right here is Debbie. So this is Debbie Luck. She is an optometrist who specializes in vision therapy. And we've talked to her before about using vision therapy for kids who are having visual problems and learning difficulties. But her office also does concussion rehab using visual feedback. And so it's basically oculomotor rehabilitation. And on the left-hand side here, I'm just showing, this is from a clinic that does vestibular therapy, unfortunately not in Calgary, but I loved his picture of it. So I just thought I'd bring it up here because it just basically ties together all the inputs that are really having an impact. And the evidence really suggests that vestibular, so that's literally head positioning and ocular motor rehab combined with neck rehab is really effective for a lot of the symptoms as well. So hopefully nobody will ever get to that point, but it gives you a chance to think about longer term, if you're not recuperating, things that you can incorporate. Now, long-term concussion risks. There is evidence to suggest that a history of concussion increases risk for other neurological diseases. So there's a role for head injury in the production of Parkinson's disease. And there's results from analyses that really provide support for that. It suggests that a history of head trauma leading to concussion is associated with a higher risk of Parkinson's disease. And that's basically meta-analysis from 22 different studies. It basically increases your risk from like a unit of 1 to a unit of 1.57. So about 1 and a little bit more than half the times of risk. Head trauma in adolescence, particularly if repeated, is associated with an increased risk of future multiple sclerosis, possibly due to an initiation of an autoimmune process right in the brain itself. And so this certainly further emphasized the importance of protecting young people from head injuries. Okay, so, I managed to make it under an hour. That's awesome. So this is just a little recap of the things that are coming up in December through May. So hopefully you're enjoying these webinars. I have fun putting them together, although sometimes it's frustrating, like this time when I was having so much trouble even finding basic information. I really had to dig to get something super useful out. And so I just love how many of you show up to do this every month, and don't forget to go sign up for that. And of course, thank you very much for coming. And I see that there's a couple of questions here, so I'm happy to try and recommend. So the name of that movie, there was 2 movies. So the first one was a movie that was called Concussion. It's literally called Concussion. And then the other one was called The Lookout. And I think that was 2007. And Stacy, what kind of dizziness are you talking about? Are you talking about dizziness from concussion? Because if you are, that is one of the indications for either doing listening program or oculomotor rehab. So if it's concussion related, it's something that you're going to want to think about doing something more intensively for, because there isn't a supplement for dizziness that I can think of. There are a couple of homeopathic remedies we might use for acute dizziness from concussion. But it would really depend on what the nature of the dizziness is. And how old was the concussion? How long was the concussion ago? Like recent or several weeks, or? Because if it's like longer term, literally oculomotor therapies, or like something that's actually re-engaging the vestibular system, yeah, that's something where you're going to want to probably pursue some of these other potential strategies, because, or you could even try, if you're a patient of mine, you can even try some neural therapy. Sometimes that will get rid of it. There's a couple of different things that we can try. But you're looking at some of the other therapies that are a little bit more physically revising. Yeah, it's always a challenge for sure. Okay. Other questions? You can get a concussion not necessarily with a hit on the head. Yeah, totally. You can actually have a body blow that ends up in a concussion and you just don't know. Chantel. It's crazy, but it's true. Can you imagine that? And that's one of the reasons why people think, oh, what's wrong with me? Like, what's going on here that I'm not getting better? It's really something where you can have a transmission of energy all the way through the body. It can really create a concussion, even if it's never struck your head, even if you never struck your head. Like falling on your tailbone. Yeah, totally. You could. Yeah, it's craziness, but true. Yeah, I'm hoping. Yeah, it was as interesting for me to make it as it probably was for you to listen to it. It really reinforced to me how quick you need to be to really have an impact on head injury. And like I said, if you want to see the link at the Full Script account, you'll see that there's a protocol there for concussion symptomatology, and you're welcome to take a look at it. All right. Good night, everyone. I'm glad to see you all here. Have a wonderful week, and we'll see you next time.
Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.